high rates of incarceration. Prisons are not healthy places. The environment would be safer. There would be less pollution. There would be less crime. People would have a living wage, and many of the stressors in daily life would be removed. I think education is a huge component as well. This country suffers from, I think, a very poorly educated population, particularly in the area of science education. And I think that a good understanding of science is important to promote health as well, and to promote proper legislation, proper healthcare policy, and not to mention medical education. Jim didn't mention anything about the education of physicians, but this has a huge impact on the structure of healthcare in this society. I believe that it now costs something like $35,000 a year for medical school, just the tuition, without the books and the living expenses and transportation and so on, at the State University, University of California, a year. And medical school here is 4 years, so people graduate with the debt in the hundreds of thousands of dollars because there's no good public funding, there's no good grant system to help students pay for education, and what you end up with is either a huge debt or only people from wealthy backgrounds go to medical school. And in order to pay back this debt, the students are very much focused on professions that are going to earn a high income, and in this country that is specialty care. Primary care, for many reasons, is not promoted, one of them being financial. Another is prestige, and another reason is the way that the healthcare system is structured. I think that in order to achieve good healthcare for everybody, there needs to be a very strong primary care system, and which I've experienced, for instance, in Holland, where I went to medical school, which is still a capitalist country, and their healthcare insurance system has taken huge steps backwards in the past few years. But when I was there anyway, healthcare was truly not for profit, and everybody had access to healthcare, and the family physician played a very central role in healthcare. Everybody had in their own community a family physician that they would go to for all their routine needs. They often work together in a health center with physical therapists and social workers and nurses, and worked on preventive care. They did home visits. When I was there, we went on our bicycles and did home visits. And if there was something beyond the capacity of the primary house arts, they call it, a family physician, then the patients could be referred to secondary or tertiary centers for specialty care. I think that that's one component that's often missing in this debate in this country about access to health care. It's not only the financial part, but how do you actually access the health care? The system as it is now, with very fragmented care and without a central person that you can go to as the first step for your health care, I think is totally moving in the wrong direction. Primary care, preventive care is cost-effective. Specialty care is expensive, and most people don't need specialists, even if they think they do. The family physician can usually take care of most needs and would be a good place to start. So anyway, under socialism, there would be, of course, money, resources devoted, human resources, financial resources, technical resources devoted to meeting human needs rather than for profit or for the military, for instance. There's many things that would be different. However, many of these things can still be accomplished in the capitalist system. And I think that if you look at what's going on in other countries, other capitalist countries, people are doing better. Healthcare indicators in other parts of the world, Canada, all of Europe, Japan, are so much better than the United States. While we spend more than twice as much money per capita on healthcare, the indicators such as maternal mortality are much higher in this country than in other countries I just mentioned. Infant mortality is much higher here. Life expectancy is much better in other countries. Infant mortality, life expectancy, for instance, are better in Cuba, which is a poor country, which has socialized medicine and heavy emphasis on preventive care and on primary care in the neighborhoods. Literacy can also be improved. My patients are generally very poor and have limited resources and often poor education. And it's difficult to help them access proper services and help them understand their health care if their education is so limited. So I think that's something else that we can focus on literacy, health literacy, science education. I think the central problem is this concept that healthcare is not a service, it's not a right, but it's a potential for profit for insurance companies in particular. What an immoral idea that a company that takes people's money, often public money, and has the obligation to provide medical care is trying to make money from this. I mean, the whole concept is immoral, and I believe many of my colleagues see it this way also. I'd say that among physicians there's a universal hatred of insurance companies. They make our lives difficult. They cost lots of money in private practice. We had a couple of people in each office whose job it was to deal with insurance companies, to get authorization, to see if the patient could come with this particular insurance plan to our office, and if she needed some other services and needed hospitalization, what hospital could she go to? And even in the public sector, a lot of our patients have like these private Medi-Cal HMOs, which is one of the most immoral things you can imagine, are tax dollars going to support Medi-Cal, which is then turning the money over to for-profit Medi-Cal HMOs, the CEOs of which make, average, I think, of $20 million a year. How can you possibly justify anybody making $20 million a year, and especially somebody whose job it is to deliver health care? Knowing that about 30% of the premiums that we pay go to administration and profit for these insurance companies is infuriating. Just think of all the things we could do with more money, and that money is going to investors, shareholders' profits. And what an immoral concept. We have another office for our private practice that deals with billing and with sending letters and threatening with lawyers for the insurance companies that don't pay the things that we bill for. And every physician, I think, who works in the private sector has this experience. At the university, I don't know how it happened, but Tenet, one of the worst of these for-profit health companies, the hospital company for profit, owned the university hospital. And the physicians spent a lot of their time complaining about Tenet, and we were so happy when we finally got rid of Tenet, and now the university owns the hospital, which is a big improvement. I need to make a comment on this Baucus bill, which Jim was talking about. This is pure junk. This was designed by the Democrats, and it's apparently not conservative enough for the Republicans to sign on to, but I don't know why they would be unhappy with it, because it totally promotes the insurance companies with a requirement for people to buy insurance from commercial companies, and it's no better than what we have now. From a physician's perspective, it might actually be a little bit better, because more people will actually have insurance, which will help us provide better care. But the thing that needs to be done is this whole insurance industry needs to be eliminated, and it's too bad for people who work for the insurance companies, but they can be retrained and they can do something actually useful. They can do home health care, they can do prevention, they can work on vaccination campaigns, they can develop educational materials, they can look for efficiencies, improvement of efficiency in the healthcare system. There's lots of useful work they can do, and plus they'll feel much better about themselves. So I think this whole industry just needs to be eliminated, and anything short of that is not going to achieve the real improvement that we're all hoping for. And while I'm, of course, very angry with what Obama and his cronies are doing, it is not surprising. This is to be expected. We knew this was going to happen, and a real change in the so-called democratic system is necessary, and a whole change in the way healthcare is paid for. But Obama and his friends are just working for the insurance companies like everybody else. They have bought the legislators, and they should be overjoyed with the